Welcome to the Deep Dive, where we try to make complex stuff accessible and hopefully pretty fascinating. Today we're doing a deep dive just for you, really digging into the information you've shared with us. We're focusing on a specific health journey, understanding a procedure called catheter-directed thrombolysis. This is used for deep vein thrombosis. That's blood clots, especially when they're in those big veins in your leg and pelvis, the iliofemoral vein.
That's right. Yeah, a DVT, a deep vein thrombosis, particularly in those larger veins, well, it can be quite serious. And this procedure, catheter-directed thrombolysis, is one of the ways doctors aim to, clear out that clot and get blood flowing properly again. So our goal today, using the info you gave us, is to build a sort of roadmap for you, like a guide, step by step, to help you know what you might potentially expect if this treatment is on the cards for you. We'll keep it straightforward.
Okay, great. A roadmap sounds really helpful. Let's unpack it together. Step one, what might happen when you first get to the hospital, when you're being evaluated?
All right, so when you first arrive, the medical team, they really need to understand what's going on. A big part of this initial check is taking a detailed medical history. They'll ask about your symptoms, what brought you in, how long it's been bothering you, where the discomfort is, what it feels like, all that detail.
Okay.
And they'll definitely ask about any history of blood clots before, other health issues you have, any allergies, and this is really important, every single medication you're currently taking.
To get the full picture.
Exactly. It helps them build that complete picture of your health situation.
So they gather all that background info. What about the physical exam part? What are they looking for there?
The physical exam. Yeah, that's also crucial for figuring things out. Often they'll need a good look at your legs. Sometimes they might ask you to stand up if you can. They're searching for visible signs, things related to the DVT.
Like swelling.
Yes, exactly. Swelling is a big one. They might even get out a tape measure and check the circumference of your legs, maybe at the ankle and calf, to see how much swelling there is. They also look for skin changes, maybe redness, or sometimes darker patches, pigmentation changes.
Okay.
And while this procedure is mainly about the veins, they might check your pulses too, just as part of a general circulation checkup. It's all about collecting those physical clues to add to your story.
That makes a lot of sense. So they're putting the pieces together, what you tell them, what they see and feel, to really understand the problem and how bad it is before deciding on something like this specific procedure.
Precisely. It's all geared towards getting a really clear understanding to figure out the best way forward for you, the right treatment plan.
All right, let's move to step two on our roadmap. This is often the bit people are most curious or maybe anxious about. What actually happens during the procedure itself, this endovascular thing. Your information mentions using thin tubes, catheters, and wires inside blood vessels. How does that usually work?
Okay, yeah, the procedure itself. So these endovascular procedures, they typically start by getting access to a blood vessel. Often it's in the leg, maybe near the groin. The common femoral vein area is pretty common, but sometimes they might need to use a different spot. Just depends on your specific case. Once they have that tiny entry point, they carefully thread thin wires and those catheters into the vessel.
Wow. And how do they know where they're going? Inside your veins? That sounds incredibly tricky.
It is quite intricate, yeah. They use really advanced imaging to guide them. The information mentions things like angiography or using a C-arm.
A C-arm?
Yeah, think of a C-arm as like a special X-ray machine that moves around you and gives them real-time pictures, almost like watching a live video feed.
Oh.
It shows exactly where the wires and catheters are as they move them through the vein. Angiography is similar, using X-rays, sometimes with a contrast dye injected to make the blood vessels show up really clearly.
So they're basically using these tools and live pictures to navigate right to the clot.
Exactly right. They guide those instruments very precisely, using the imaging right to where the blood clot is sitting in the vein. Now, for this specific procedure, catheter-directed thrombolysis, they use special catheters designed to deliver medication.
Clot-busting medication.
Yes, powerful clot-dissolving medicine delivered right onto or into the clot itself. The aim is to break it down, dissolve it. Sometimes they might also use something called aspiration.
Aspiration?
Yeah, it's basically like using gentle suction through the catheter to help pull out pieces of the clot. So the main goal here is to clear that blockage, or at least reduce it significantly. Oh, and it's worth noting, since X-rays are involved, the info mentions radiation safety. They use specific equipment and measures to keep radiation exposure as low as possible.
Okay, so navigate there, use the medicine, maybe suction. Is that usually it? Or are there sometimes other steps involved?
Good question. Clearing the clot is the main thrombolysis part, but yeah, sometimes more is needed during the same session. For instance, if the vein seems a bit narrowed where the clot was or leading up to it, they might inflate a tiny balloon inside first.
A balloon.
Yeah, just to gently stretch the vein open a bit. That's called predilation. It can help the medication work better or just open the channel. And importantly, sometimes they find the vein isn't just blocked by clot, but it's actually being squashed or compressed from the outside. This can happen especially in the pelvis area, sometimes called iliac vein compression.
Ah, right.
If they see that, clearing the clot might not be enough long term, so they might decide to place a stent.
A stent. What exactly is that?
A stent is like a tiny metal mesh tube. They place it collapsed inside the vein, then expand it. It acts like a scaffold, basically, propping the vein open from the inside to make sure it doesn't get squashed again and blood can flow through easily.
I see. So it helps keep the vein open long term.
Exactly. So the exact mix, medication, suction, balloon, stent, it really depends on what they find when they're in there. It's tailored to you.
It's pretty amazing what they can do inside a blood vessel.
It
Okay,
is.
so the procedure's done. What happens immediately after? What's recovery like? That's step 3.
Right. After the procedure, you'll usually head to a recovery area. The team there will monitor you very closely, checking vital signs, the access site where they went in, things like that. And a really, really critical thing that happens right away, based on the information, is starting therapy to prevent new clots.
Okay.
This is generally called antithrombotic therapy, and specifically, it means starting anticoagulation medication.
Anticoagulation, so blood thinners.
Yeah, that's the common term, blood thinners. The information really stresses how important starting this is right after the procedure. It's key to cutting down the risk of more clots forming.
Makes sense.
And there's something else often started quickly, too. Compression therapy.
Ah, the stockings again?
Exactly. Compression stockings or sometimes bandages. The info highlights this as like a cornerstone for venous problems. Putting them on soon after helps manage swelling, supports the vein while it heals, and helps with blood flow.
So medication to prevent clots and compression. Sounds like 2 big takeaways for right after the procedure.
Definitely. Based on these materials, those seem to be top priorities in the immediate recovery phase.
Okay, moving along our roadmap to step 4. What about when it's time to leave the hospital? What happens after discharge, managing things at home?
Well, the information is pretty clear that the antithrombotic medication, those blood thinners, started in hospital. That's almost certainly got to continue after you go home.
For how long, typically?
The duration varies a lot depending on the person and the situation, but it's often for a significant period. Continuing it is seen as absolutely essential for preventing clots from coming back. The info mentions there are different types, including some newer ones called novel oral anticoagulants, or DOACs. Your doctor decides the best one for you.
And the information also mentioned that these medications, while important, have risks too, right? Like bleeding.
Yes, that's a really important point it brings up. These drugs are great at preventing clots, but they do increase the risk of bleeding. It's a trade-off, a balance. Doctors weigh the benefit against the risk for each person very carefully. You'll get specific instructions on taking the medicine safely and what signs of bleeding to watch out for. It's crucial to follow those instructions exactly.
Okay. What else is key for managing at home?
Well, that compression therapy we mentioned,
Yeah.
that often continues long-term too.
Still wearing the stockings.
Yep. Wearing the compression stockings consistently, as your doctor advises, is really important for supporting the veins and managing any leftover or chronic swelling. It becomes part of the routine for many people, and follow-up is vital. The information stresses this. You'll have appointments after you leave the hospital. These often include more imaging tests, like that duplex ultrasound we talked about.
Right, the sound wave test.
Yeah. It lets them look at the treated vein, check the blood flow, make sure the stent, if you got one, is working well, and just generally monitor how you're healing. So keeping those appointments is really important.
So stick with the meds, keep wearing the compression, and definitely go to the follow-up checks. Got it. But what if something doesn't feel right after you're home? What are the warning signs? Step 5.
Right. Being aware of potential problems is key. The information does touch on things to look out for. For example, if you suddenly get a lot more pain in that leg or new pain develops, that could signal something's wrong, maybe an infection or perhaps an issue with the vein again.
Okay, increased pain. What else? You mentioned bleeding risk with the meds?
Exactly. That's a major one to be aware of. Any significant or unusual bleeding needs attention right away. What's unusual? Well, things like blood in your urine or blood in your stool, which might look black and tarry, or coughing up blood, nosebleeds that just won't stop, or finding you're bruising very easily, or bleeding way more than usual from a small cut.
Those all sound like things you'd need to call the doctor about immediately.
Absolutely. Don't hesitate. It's better to get checked out. Now, the source material talks about serious complications of the original DVT itself, like clots traveling to the lungs, but it doesn't spell out a specific list of post-procedure symptoms for the patient to monitor. However, just thinking logically based on everything, you'd want to be vigilant for any signs the original problem might be coming back.
Like the swelling returning.
Yeah, exactly. If the swelling, pain, redness, or warmth in your leg starts to come back or gets noticeably worse, that's definitely something to report to your healthcare team promptly. Any sudden, new, or worsening symptom needs checking out.
That awareness seems crucial for safety. Okay, let's talk prevention. Step 6. Stopping this from happening again must be a huge priority. What does the information say is the best way to lower the risk of another DVT?
Well, based on this information, the number one strategy, the thing that's really emphasized again and again, is that long-term antithrombotic therapy, staying on the anticoagulation medication.
So taking that blood thinner medication long-term is the main defense.
Yes. According to these sources, continuing that medication exactly as your doctor prescribed is presented as the absolutely essential step. It's what significantly lowers your risk of having another clot. It's consistently highlighted as the most critical preventative measure.
Right. Very clear. Now for our final step, step 7. Even if the treatment works well and you take the meds, sometimes people can still have long-term leg issues after a DVT, something called chronic venous insufficiency. How does the information talk about managing that?
Yeah, that's a possibility. Chronic venous insufficiency, or CVI, is described as a potential long-lasting issue with the veins. It can happen after a DVT, sometimes leading to what's called post-thrombotic syndrome. The typical symptoms are things like ongoing swelling in the leg and sometimes skin changes that develop over time, discoloration, maybe the skin gets hard or leathery, or even ulcers in severe cases.
Okay, and what's the plan for managing those kinds of long-term problems?
For managing CVI long-term, the information basically circles back to the conservative approach being the starting point. And the absolute cornerstone, the foundation of that conservative management is, you guessed it, compression therapy.
Back to the compression stockings again, even potentially years later.
Precisely. The information consistently points to wearing compression stockings or using other compression methods as the main thing, the fundamental element for managing CVI symptoms and post-thrombotic syndrome. It helps control the swelling, supports the veins, and can prevent things from getting worse. Now, if compression and other simple measures aren't enough, the info does note that other, maybe more invasive treatments could be considered down the line. But compression is always highlighted as that bedrock of long-term care based on this material.
Okay, so wrapping this up, what's the big picture here? We've walked through this potential roadmap, starting from getting checked out, understanding the procedure, the recovery, managing at home, knowing the warning signs, focusing on prevention, and even looking at long-term care, all based on the information you provided. It's clearly a complex medical journey, but hopefully understanding these steps, the role of the procedure, why the medication and compression are so vital, what to watch for, gives you a much clearer perspective on what might lie ahead.
Absolutely. And thinking about this whole process, it kind of leads to a final thought, maybe a question for you to consider. We know that managing vascular conditions like this can sometimes be a lifelong process, even with successful treatments. So the question is, how does being informed, like by understanding this roadmap we've talked through today, and feeling empowered to ask questions and really partner with your healthcare team, how does that actually change the experience of that journey for you? Something definitely worth thinking about as you navigate your own health path.